Hello everyone. Welcome to the series on ICMR Scientist B non-medical preparation. If you find this video helpful, then make sure to follow and subscribe to the channel. Here I will be sharing important concepts and probable questions for the examination. So let's start. Today's topic is cohort study. So what is a cohort study? So a cohort study is an observational study design where a group of people is followed over time to see whether particular exposure leads to a specific outcome or not. For example, suppose researchers want to know whether smoking causes lung cancer or not. So initially they divide peoples into two groups, smokers and non-smokers. So then they followed these both the groups for several years and compare how many people in each group develop lung cancers. So this is called a cohort study. Now coming to the types of cohort study. So there are two types of cohort studies. One is prospective cohort study and second one is retrospective. So what is prospective? Here participants are selected at present. The researchers follow them into future up to a certain time point, and finally the outcome occurs after the study begins. So example, a study that started in 2026 and follows participants until 2036. Similarly, retrospective cohort study. Here, both exposure and outcome have already happened in the past. Researchers use those records only. That means they look backward in the time. Example, a study that uses hospital records from 2010 to 2020. Now let's know about the measure used in cohort study, that is relative risk. So relative risk compares disease occurrence between exposed and unexposed groups. And the formula for relative risk is incidence in exposed group divided by incidence in unexposed group. So let's take the example of smoking and lung cancer. So if the relative risk is 1, there is no association. That means smoking and development of lung cancer has no association. If the relative risk is greater than 1, that means exposure increases risk, which means that if you will smoke, then you have higher chances of development of lung cancer. Then relative risk less than 1. That means exposure may be protected. That means if you smoke, then you have less chance of development of lung cancer. Now let's solve few questions regarding the cohort study. The first question is design in which exposed and unexposed groups are followed over time to compare the incidence of diseases called. The options are case control, ecological, cross-sectional and cohort study. And recently we have studied that in cohort study, the exposed and unexposed groups are followed over time to compare the incidence of a disease. Hence, the answer is cohort study. The second question, which design is most appropriate for studying the protective effect of breastfeeding on childhood asthma? That means here researchers want to establish a correlation between breastfeeding and development of childhood asthma. The options are RCT, cross case control, and cross-sectional and prospective cohort study. So here the right answer is prospective cohort study, because in present the newborn baby and their mother are the participants. The researchers will follow them for several years to study that whether breastfeeding and childhood asthma has any correlation in between them or not. So the next question is, the main advantage of retrospective cohort studies is option 1, no confounding, option 2, strong temporality, option 3, availability of historical data and shorter study duration, and low cost always. And the right answer is availability of historical data and shorter study duration. So we have discussed that in retrospective cohort study, so the data were already there. We have to look into those data and find our outcome. That's why the advantage is availability of the data already and the shorter study duration. The next question, which study design is most appropriate when the research question is does smoking causes lung cancer? So we have already discussed, and the answer is prospective cohort study. Moving to the next question, the design best suited to study the natural history of a disease each. The options are prospective cohort study, case control study, cross-sectional study, and randomized clinical trial. So what is the natural history of a disease? So natural history of a disease means the development of a disease in a healthy participant or healthy person. So researchers will take few participants, those are healthy. They may develop a disease or phenotype in future. Hence, they will follow them particularly, and finally, they will able to find the natural development of the disease. So the right answer is prospective cohort study. The next question, which design is best for studying the incidence of dementia in a population over time? So before that, we should know what is dementia. So dementia is an umbrella term for progressive decline in cognitive functions such as memory, thinking, and behavior that disrupts daily life, typically in people over 65. So the options are cross-sectional study, case control study, prospective cohort study, ecological. So the right answer is prospective cohort study. So the researchers will uh, take few people or participants from old age, and they will follow them to study the development of or incidence of dementia. Coming to the next question, that is, which design is most appropriate for studying adverse drug reaction that occurs many years after exposure? The options are case control study, retrospective cohort study, cross-sectional study, and randomized clinical trial. The right answer is retrospective cohort study. Let's understand this question. So there is a drug. Patients are taking that drug to cure their disease, but by the time they are also developing few adverse effects. So now researchers want to know the correlation between this drug and the adverse effects. Hence the data were already there. So we need to look into both the data, and finally we need to set the correlation that whether this use of this drug is developing these side effects or adverse effects or not. Hence it is a retrospective cohort study. If you found this video helpful, please like, share and subscribe to Pathfinder for more such educational content. Don't forget to hit the bell icon so you never miss out our latest videos. I have just uploaded exam series part 1. If you want part 2, make sure to mention in the comments below. Thank you for watching. See you in the next video.